Hello, my name is Dr. Dianne Chambers, and I'm a board-certified OBGYN at Norman, Oklahoma, and I'm affiliated with Norman Regional Hospital. Today we're going to talk about the COVID-19 vaccine. I have a lot of patients who have a lot of questions about it. Is it safe in pregnancy? Is it not safe? There's a bunch of rumors and misconceptions, and I just kind of wanted to talk a little bit about it today to help maybe alleviate some of your fears. One of the first questions I get is it okay if I am pregnant or breastfeeding to take the COVID-19 vaccine? And the answer is yes. It is approved for pregnant and breastfeeding women. Just like the general population, it is safe to take in pregnancy. Another question is, are pregnant women at increased risk? Pregnant women in general are considered a vulnerable population when it comes to any type of diseases, infectious diseases. And so COVID-19 is the same. They're considered increased risk for having a severe illness, which means if I get COVID-19, they're at increased risk when you're pregnant to be hospitalized, to require mechanical ventilation, to maybe have a prolonged course. So you're considered more susceptible of being more ill when you're pregnant. Another question is, does the COVID-19 vaccine put my unborn baby at any risk? And that question is an unknown. In general, vaccines are considered safe. We use vaccines in pregnancy all the time. The COVID-19 vaccine is new for treating COVID-19, but vaccines are not new for giving to pregnant women. There are women and there are studies currently going that have received the COVID-19 vaccine. They have become pregnant or were pregnant. They have had their babies, and there have not been any studies or anything that has shown unsafe for your unborn child. There are animal studies. In order to get the vaccine approved by the FDA, they had to have a lot of animal studies. The animal studies showed no harmful effect to the animals' fetuses. It also didn't show any harmful effect to the animals. Another question, when receiving the COVID-19 vaccine while pregnant, will it transfer possibly to the baby and help protect the baby? That is something that we think is true. What we are seeing is when people have been given the vaccine in pregnancy, we have seen antibodies in the babies when they are born. We are also seeing antibodies in breast milk. Does that mean your baby is protected? We don't know. But we do know in prior vaccines, such as the whooping cough vaccine, which we give in the 3rd trimester, those antibodies help protect your baby in the first year of life from getting whooping cough. So if you look at vaccines, technically, if there's antibodies, it should protect your baby from COVID-19. And we do see antibodies for vaccinated moms. Most of the time, those are if they receive the vaccine in the 3rd trimester. But since it's such a new vaccine, it hasn't been out long enough for us to study. It's not even been out 6 months yet, so we don't know long term if you get it in the 1st trimester, if the baby will have antibodies or not. But that's something that would be a bonus if they do. The vaccine was recently created, and few, if known, tests have been done on pregnant women. How do I know it's safe? When it comes to vaccines, even though the COVID-19 vaccine is new, the concept of these vaccines are not new. They've been studying messenger RNA vaccines for years. The Johnson & Johnson vaccine actually has the way that vaccine works. They have studied it with Ebola, and it has controlled trials with Ebola pregnant women, and it did not show any harmful side effects. So in theory, it's the same type of vaccine. We're just using it for COVID-19, and it should be safe. Although, with it only being 6 months old, there are no studies, and it will be a while before we have those studies. Another question, Which trimester is it preferred if I do want to get the vaccine? That's also, it's whatever. If you want to get the vaccine, it's whenever you want to do it. In theory, the third trimester might be the best if we want to have antibodies to the baby, given to the baby. But technically, to me, if you're going to vaccinate, you can vaccinate anytime. You don't have to wait. You can just get your vaccine when you're ready. Another question. I've heard that the 19 vaccine can cause infertility or fertility issues. That is a very popular thing on social media. Infertility if you get the COVID-19 vaccine. There is no studies that even would suggest why this would be true. The animal studies, it was not true. There's nothing in this vaccine that would cause infertility. It doesn't work in a way that would affect your fertility. It doesn't go into your DNA cells. The way the vaccine works just causes your own body to create antibodies to COVID. It has nothing to do with fertility. Let's see, another question. Do I recommend this vaccine? I do recommend the COVID-19 vaccine to pregnant women and breastfeeding women. It is a vaccine that it is optional. It is based on what your preference is. So what you need to do when you're thinking about vaccinating is think about what is the likelihood that I might get COVID? What is my exposure risk? Do I have small children around that I could possibly get COVID? Do I have medical conditions that would make me more prone to be hospitalized if I do get COVID? You kind of have to weigh the pros and the cons. If you're asthmatic, if you're diabetic, if you have other medical problems that if you had COVID, you would be sick, then you may want to consider getting COVID vaccinated because it's better than the alternative of being very, very sick in the hospital. Another question, is one vaccine safer than the other? That is a question that's an unknown. The Pfizer and the Moderna vaccine are very similar vaccines. They work in the same way. One of them is approved for 12 and over. The other one is 18 and over. So the reality is that one is based on where you fit and if you qualify for the vaccine. I don't think one is different than the other. They're both highly effective. Their adverse reactions are similar, and their effectiveness is very similar. The Johnson & Johnson vaccine is totally different. It is highly effective, and it's in a one-shot vaccine. There are some studies that show an increased risk for a rare clotting disorder. So if you have an increased risk for a clotting disorder, you may not want to use that vaccine, but it's a very rare disease. And so it didn't show increased risk in pregnancy versus unpregnant women. So to me, whichever vaccine fits best would be the one that I would pick, or whichever vaccine is available to you. Another question is COVID-19, if I'm fully vaccinated, do I still have to wear a mask when I am delivering a baby? And the answer currently, as of now, is yes. You still have to wear masks into acute care facilities. In the hospital, there are other patients around you who are not part of your group. So the 6 feet apart and the mask rule is still in effect because of other visitors to the hospital. When you're in your room with just you and your family, no, you're not required to wear a mask. When other people come in, because you don't know their vaccination status, it is recommended that you wear a mask with other people in attendance. Another question that I forgot to talk about, which was an early question, is side effects. What is some potential side effects from the vaccine? And what we see with this vaccine is we do see flu-type side effects in 10% of the population. So you may have a fever, you may have some flu-type illness. It usually lasts less than 24 hours and goes away. The other thing is that you can have an allergic reaction to this vaccine. It's very rare. It's reported in like 1 per million, but you can be allergic to the vaccine. So they do recommend if you have a history of allergies to other immunizations that you may not want to do the COVID vaccine at this point. So that's kind of a synopsis of the COVID vaccine. It is readily available. It's very easy to receive. Most of the pharmacies now have all three, and you can schedule an appointment pretty easily. So if you are interested in the COVID vaccine, please, consider getting it. If not, that is your right. I recommend it, but that does not mean that it's for everybody. And so, when considering it, you have to weigh your risk and your benefits and what's best for you and your baby. So, okay. Well, thank you very much.